Fund Healthcare, Not Warfare working group, the person who always keeps those issues front and center. Alan, take it away.
Thanks, Jonathan. Yeah, Alan Meyers here, and I was a founding member of Physicians for National Health program back in the mid 80s. So on the one hand, I'm
still sleep on me through the day.
Everybody, please mute.
Yeah, I'll mute these
Okay.
extra people. Yeah.
On the one hand, I'm really encouraged that single payer healthcare, now called Improved Medicare for All, is in the public view more than it ever has been. And on the other hand, as we've heard all day today and are going to hear more about it, single payer only addresses the financing of healthcare in the United States, and we need much more than a financing fix to get to real healthcare justice. And I think that's what we're going to be talking about some today in this final session. We have with us Bonnie Gorman, Stephanie Woolhandle, and Larry Cohen. Let me introduce each one. I think we have about 8 minutes for a presentation before the Q&A, which we'll do at the end. So Bonnie, first up, Bonnie Gorman, a nurse with 60 years experience in healthcare and social work internationally and in the United States. She served in combat support in the Navy as a medevac nurse in Vietnam between 65 and 70. She's a member of Gold Star Families for Peace, having lost a brother in Vietnam and a nephew in Iraq. She is currently Legislative Committee co-chair of Mass Peace Action, active with South Shore Medicare for All Coalition and Veterans for Peace. Bonnie.
Unmute.
Oh, unmute myself here. I'm going to cover some state initiatives that we just talked about. One is that in Massachusetts, we don't have a consistent public health infrastructure. We have 351 cities and towns who create their own network of public health infrastructure, and it's very localized and very often local control, and so it's not at all standardized across the state. So there has been a major effort to bring it together. This was identified long before COVID, but COVID brought it to the forefront as a crisis in the public health. And this would be an effort. It's really state action for excellence in local public health. And the goal is to be able to create a systemic statewide system of public health that would establish minimum standards for each city and town. It would establish a whole range of public health standards along healthcare issues, restaurants, infectious diseases, and to create local and regional regional public health networks. Too much mental health stuff. Public health networks as a best practice. So, and it will increase capacity and effectiveness across jurisdictional, really for the improvement of public health itself. We just had a discussion on this, and we have had nearly success in passing the bill, although we're having problems with local opposition. For example, my city of over 100,000 does not have it has public health department, but no public health board, because the mayor doesn't really want one. And so, he, for example, would be opposing this bill. But we have gotten funding, 15 million in special grants to make this happen and to try to help organize the state under the public health realm. And it would also sustain uniform collection and reporting standards for the Department of Public Health, because right now there is no standard, and they have and there's no jurisdiction, and there's also no licensing. So this is a reform model on public health in our state. Other states are further ahead than we are because they do more systemic statewide systems of care in public health. So that's one thing I wanted to talk about. And the other thing I wanted to cover is Senator Liz Miranda could not be here today, and she was going to be speaking on the issue of relative to birthing justice in the Commonwealth. We have, unfortunately, in Massachusetts, according to the March of Dimes, in a recent study, we are finding that minority children have a death rate that's 6 to 8 times that of white children, and their mothers have a death rate of 2 to 3 times that of our white population. And that's pretty appalling, and that really broke the senator's heart and felt like she wanted to do something. So we have a whole initiative going on about trying to create both justice and equity on the maternity birth front, and the fact that in Massachusetts, the land of plenty as far as health and as far as insurance goes, you know, we are failing our families. So there was a bill moving along, midwifery and licensing of it, and allowing for doulas. So a whole shift in who is delivering maternal and child care. And so we are pushing forward on that legislation. There was just a hearing this week on it. But actually, that was last session in Congress, in not Congress, in Massachusetts sessions. And this session, 24 different bills were merged into a really an omega, just an omnibus bill for maternal and child health, from early, covering a whole variety of testing and preterm to postpartum issues, delivery issues, childcare, pediatric issues. And there was a year-long report that's been presented, and I can send that out to people, on what the failures have been in that system. So I did want to let you know about Senator Miranda's report here in Massachusetts. This is not a national issue. It's here in Massachusetts, but it is, I think, very promising, and we will keep you posted on this issue. The women's groups are working closely on it. So I don't know whether that time-wise, I'll just stop there, because Alan's going to cover all of our work on Medicare for all and single payer. So
You have a couple of minutes, Bonnie, if you'd like.
Oh.
Otherwise, we can move on to
No, that's
to
fine.
Steffi.
Yeah.
Okay, then. Next up, Dr. Steffi Woolhandler is with us. She is Distinguished Professor in the School of Urban Public Health at Hunter College, City University of New York's Graduate Center. She is an adjunct clinical professor at the Albert Einstein College of Medicine and a lecturer in medicine at Harvard Medical School. Steffi's was co-founder of Physicians for National Health Program. And I would commend to you an article that she recently was interviewed along with David Himmelstein in Jacobin magazine on this past May 2nd, on the subject, "We don't just need Medicare for all, we need a national health system." So Steffi will be talking to us about single payer versus national health service. Steffi, thank you for joining us.
Okay, well, I think I'm not going to be covering the general issues about why we need Medicare for all, or the general issues about everything that's wrong with healthcare spending and health outcomes in the United States, because I think other people in this session are going to be talking about it. Though I just want to say that I, like Alan, was one of the founding members of Physicians for a National Health Program, and really have been very active in the single payer movement throughout my career and continue to be active in it. However, we feel that just that single payer Medicare for all is not going to be enough, that we are going to need some sort of ownership reform. And I just want to give you a sort of a conceptual framework of how I think about this. If we think about finance capital, and I know many of you are not used to thinking this way, but economists think there's two types of capital. There's productive capital, like factories and hospitals where we actually do stuff and make stuff. And then there's finance capital, like insurance and banks that don't do anything or make anything, that just push the money around. So if you think about single payer, the key idea in single payer was you just get rid of the insurance industry, because in the past, the insurance industry was a major representation of this finance capital. They were the only actors in healthcare that were purely financial. The other actors, like doctors and hospitals, they might do bad things, but at least they're producing something. They're part of the productive part of capitalism. And we just thought, well, if we got rid of the insurance industry and have the Medicare, the federal government take control of the finances, we'll be able to control the doctors and hospitals, because we thought that would happen. That's what happened in Canada. They have a socialized insurance network, and the provincial government has a lot of control of what doctors and hospitals do. Now we're in a very different situation, because finance capital is involved in healthcare in a much, much more deeply and much more fundamental way. And for-profit firms are all over the place in healthcare at this day and age. The financial sector is directly gaining control of healthcare and turning it into a fully for-profit enterprise. And that's a little different situation than what we faced 50 years ago. And I just want to talk about what this means in several ways, that finance capital is in control. So now we are moving toward this era of mega corporations. You've heard about, Amazon and Apple and stuff. But we also are moving toward an era of healthcare mega corporations, these mega corporations with tentacles in all parts of the healthcare system. So the number 4 largest corporation in the United States in the Fortune 500 is CVS Aetna. It's CVS Pharmacy merged with Aetna, the insurance company. And they don't just provide pharmacy and insurance like Aetna. They have these pharmacy benefit managers that run these gigantic mail order pharmacies, minute clinics. They just bought up Oak Street Medical, which is a string of primary care clinics. So they're going to be soup to nuts, from the insurance company all the way down to the primary care doctor to the drugstore. The drugs you buy, it's all going to be owned by one mega corporation. The number 5 largest corporation in the United States is United Healthcare. It's the largest insurance company. I think they have about 55 million people who they cover. But in addition, they have these other divisions. Their Optum division owns 70,000 doctors in the United States, close to 10% of practicing physicians, at least 7%, I guess. And they're the biggest employer of physicians in the world. So the insurance company's the biggest employer of physicians. They also own 2 giant pharmaceutical benefit management companies. They have a giant analytics, big data division that keeps all the health data moving and making profits for people. They're buying up home care, nursing homes. So they're giant too. And even our number 2 company in terms of size, Amazon, is entering medical care big time through telemedicine, through buying One Medical concierge primary care practices. Walmart, the number 1 company, is trying to get in. I don't know if they're going to get as far as Amazon, but we're talking about these giant corporations that seem to own and control everything, now owning and control everything, trying to acquire ownership and control of everything within healthcare, beginning with your insurance, through your hospital, through your doctor, through your home care, through your medication. We want to talk just briefly about private equity, which is the new kid on the block. It's a cowboy capitalism. It used to be called leverage buyouts. And for some of you who saw that movie, Barbarians at the Gate, they tried it out, I guess, with R.J. Reynolds. They're very opaque ownership structures because the company is not sold on the stock exchange. So it doesn't have to do SEC reporting. So you don't even, half the time, you don't even know who owns the companies. But they've moved into healthcare big time because they see huge profits. They have a very short timeline. The timeline's usually 3 to 7 years. They go in, they make their profit, they get out, and they're all over the place. They are buying hospitals. In fact, they're the ones who privatized the Caritas system in Boston and turned it into Stewart. Remember, it used to be owned by the Archdiocese. Used to be a pretty good hospital system too, but it's been very hollowed out by the private equity company. They also have been buying, I think they own over 10% of dermatology practices in this country, 7% of gastroenterology practices. They have a huge emergency department staffing interest. They're largely, private equity is largely responsible for the surprise bills. They're entering fertility care. So really the barbarians at the gate is healthcare. I think we have a further problem that nonprofits are starting to act like for-profit wannabes. They engage in a lot of union busting activity. When MGB was trying to fight the House Officers Union that just won the election this week, they brought in a firm called Jackson Lewis, which is a notorious union busting firm with over 800 lawyers employed in union busting pretty much full time. They didn't succeed, but MGB, Mass General Brigham, was certainly willing to spend hundreds of thousands of dollars bringing them in and trying to block the union. But also for our nonprofit companies, our nonprofit hospitals are partnering with private equity on joint ventures, and they're also engaging in very aggressive debt collection. At least 1 in 5 U.S. hospitals will sue you in court if you have a medical bill you can't pay. They'll put a lien on your house, garnish your wages. So our nonprofits are not behaving well, and they're beginning to act like for-profit wannabes. So I think this leaves us in sort of a conundrum, right? What are we going to do? We're not necessarily going to be able to control the system just by getting rid of the private insurance industry. We're going to have to reform the ownership of the hospitals, both the hospitals that are now for-profit, that just the ones that are now private equity, not just those, but also these nonprofit hospitals who are misbehaving. So we need 2 things. We need first dollar coverage, universal coverage, so everyone covered first dollar to last dollar. I mean, it's not pie in the sky. It's what they have in Canada, you know. It's what they have in several European countries. We need to be pushing for that single payer plan. But we also really need to reverse financialization in healthcare. We need it in the rest of society too, but certainly in healthcare. And we need to be developing models for real community ownership and control of the hospitals, because the community, not Wall Street, needs to be controlling the doctors, the hospitals, the way that we deliver healthcare in this country. So looking forward to your questions in a few minutes.
Well, thank you, Steffi. That was bone chilling, if I might say so. Looking forward to the discussion. And our third speaker, Larry Cohn. Larry, are you here?
Yes.
Great. Larry.
Yes, I'm here.
Great. Larry is the current chair of Our Revolution. He was president of the Communication Workers of America from 2005 to 2015. He's worked to strengthen the effectiveness and solidarity of the international labor movement, was elected president of the 2.5 million worker union network international telecom sector in 2001 to 2007, founder of American Rights at Work, member of the Democratic National Committee, who was a founding chair of Jobs with Justice, also of the Democracy Initiative, a coalition of 50 membership organizations working to secure voting rights and removing big money from politics. He's a member of the Democratic National Committee, was appointed by Senator Bernie Sanders as vice chair of the Unity Reform Commission. And Larry's going to be addressing the how we can influence the 2024 elections. Larry.
Yes. Okay. Thank you. And apologies that I'm out in rural Western Maryland. So internet despite costing ridiculous amount, is never good here. So hopefully you can hear me okay. I'll keep going.
Pretty
So
good.
yeah,
pretty good.
I wanted to chop this into two parts. So first of all, thanks to everybody who put this program together today. It's always great to be with my friends in the peace movement, and in the case of today, so much more. Revolution in Massachusetts, lots of folks from ORMA have participated in this discussion. And to Amanda Nichols, who's on the national staff of our Revolution and is the communications director. So I would cut this into two parts, really. The first part is the budget fight coming now with the fiscal year 2024 budget begins on October 1. So if there is not a budget on October 1, as everybody knows here, there's either a shutdown or a continuing resolution to continue to fund the government, which would require both houses of Congress and the White House. No simple matter. So there will be a real focus on getting a budget before October 1 and a potential shutdown. But so let me say this about that. We all went through this so-called negotiation on the debt ceiling, and I would say it's, and as you heard, I did union negotiations, was president of the national union for years. We would never go into a negotiation on defense. You go into a negotiation with some mix of what are we fighting for? What do we love? What do we need? And recognizing there's another side across the table. I would say that Biden went into that bargaining where for the at least for working class Americans, the only thing he thought that he was bargaining for was to get the debt ceiling raised. And quite frankly, that's not worth much in terms of how the people that I've worked with for decades see the world. They expect, sure, to see the debt ceiling. No other nation in the world even has a debt ceiling. It's one of many things that we have that need to be trashed. But the point being that the only thing on his list besides raising the debt ceiling was passing, basically ignoring all the permitting requirements for the Mountain Valley Pipeline in West Virginia to increase fossil fuel consumption. And so obviously, again, that was for Joe Manchin, that was for Chuck Schumer and the donors. They both have gotten over $500,000 literally from those pipeline companies. And Manchin is a total believer in fossil fuels. But the point is, now the whole budget is up for negotiation. That process is starting now. Today's Zoom was largely focused on the military budget. Armed Services, not this week, but next week in the Senate starts those hearings, as well as in the House. But it's the Senate where theoretically there's a Democratic majority. There's a Democratic majority leader. There's Democratic chairs of every single committee, whether it's my friend Bernie with healthcare, education, labor, pensions, or whether it's Reid with Armed Services. And our job, this is overall, people on this Zoom and way beyond, our job is to say to those Democrats, you have two decent ones in Massachusetts, and I know that half the people on this call roughly are from Massachusetts. Markey and Warren are two of the best. Is to say to them, it's offense, and it starts now. And what is it that we love that we're going to fight for? And how are we going to fight for the things we love and fight to hold back the things that are of no use whatsoever, like the bloated military spending that the right-wing Republicans continue to push and that the White House sadly goes along with as well. So this budget process has a million details, but there's key points of engagement in it. And one is obviously the military budget. And not only do we have allies on this in the Senate, where there is a majority, but we also have allies in the Congressional Progressive Caucus. And Ayanna Pressley from Massachusetts is one of the best. And so, again, I would say, two things for all of us, and we're not going to figure it out here. But one is to push for, it won't be a people's budget, but things that we want to fight for and demand that Democratic senators fight for them. And over on the House side, with the Congressional Progressive Caucus, it's almost certain that this pattern is going to continue, where McCarthy can't ram through even a rule to put the budget on the floor. He's failed to get the quote rule. That means anything he wants to pass goes into a rule, and it's a party line vote. And so last week they shut down in the House because he couldn't even get the party line vote, the majority, to pass the rule and then consider the actual measures. So the Democrats in the House do have leverage, just like they had to vote for the debt ceiling increase. They're going to have to vote for this budget. And we need to work with the Congressional Progressive Caucus to fight on really the two fronts that we heard from all through today. One is holding back as much as possible, continuing to increase the military budget. And that's obviously the way that you avoid the debt ceiling, is to cut the bloated military budget that, as you've already heard, is more than the next 10 countries in the world put together spent. And number two is on things like healthcare. We can actually use this budget process, not for what we really love, which is Medicare for All, introduced 2 weeks ago. We need to fight for that by Sanders in the Senate and Jayapal in the House, and dozens of co-sponsors already. Yes, that's our objective. That's an objective when we look at who's going to get nominated by Democrats across the country to run in the House and Senate in 2024. Where do they stand on Medicare for All? Where do they stand on the military budget? But in this particular budget and next year, we have a real opportunity, because tucked into the Inflation Reduction Act is the beginnings of negotiation on pharma prices. And tucked into that Inflation Reduction Act is a process that will start early next year. It actually starts late this year, where Medicare and Medicaid Services identifies the first 5 pharmaceuticals, the actual scripts that they're going to negotiate. They have that right now by law. For the first time, insulin was number 1. That was this year, but it was the old insulin, not the quote new insulin. And they capped it at $35 a month. So that was something. But the point is, now they can pick 5 more, and they're supposed to be the 5, some blend of most expensive and most used. And for us, it's not just about those 5. It's about saying across this country, to working class Americans, particularly, do you want to continue to spend, you heard from Suzanne Gordon earlier, do you want to continue to spend twice what the VA spends on pharmaceuticals? Do you want to continue to spend more than twice what the rest of the world spends on the same exact pharmaceutical? Or do we want to pay what the rest of the world pays? Do we want to pay what the VA pays? That saving alone would be hundreds of billions of dollars a year. And even for federal government alone, it would be about $100 billion a year. Okay, Congress, you're into the debt and you're into the budget, and you have a frozen budget essentially based on that debt ceiling bill that you passed. Let's cut the price of pharmaceuticals. And then a similar logic, obviously, on military spending, as you heard earlier today. Why are we going to continue to fund a new round of tactical nuclear weapons as one of the most obscene things that's been in this military budget? So that's part one, right? And in the question period, we can go into some of the details of this. What I know better is how to mobilize people than every detail of an incredibly detailed budget process. But it's very clear. It's offense, not just defense. It's offense, not just defense. We need to start that now. We can't do what too much of the left did on this budget ceiling, debt ceiling, sorry, and wait till it's too late, frankly. We need to start now. Every key committee that has a part in that budget is scheduling hearings now. We need to rally around those progressives in the Senate and the House, and we need to have an alternative. And we need to then mobilize hopefully tens of thousands, hundreds of thousands of people on the phones, jamming the switchboards into the key senators and members of the House. Again, the key is the Senate, because that's where we have the majority. And the second key is the Progressive Caucus, because they have almost half the Democrats in the Democratic Caucus, and they're not going to pass a budget without the Democratic Caucus. I'm not saying that part is easy, because they'll look for Hakeem Jeffries to collude with the White House and find the Democrats that'll pass virtually anything. So that part is harder. On the Senate side, we could easily get a majority of the 50 Democrats. That doesn't mean a majority. To say to Schumer, There's got to be things in this budget that we love or we're not voting for it. And if the government shuts down, so be it. We're not going to be held accountable for that. What we're going to be held accountable for is what kind of a budget are we going to have? And then part two is in fact the 2024 elections. And right now, in key states and in key congressional districts, people are stepping up to run for House and Senate seats. And the second thing really, and this again is what in our revolution, what we do a lot of, it's to engage in the Democratic primaries. It can't be a question of, a binary choice. It's the Democrat or Republican, or I don't vote at all, or I vote for a candidate who's not very likely to win. It's get engaged in the Democratic primaries, where even last year, a lot of progressives, about 15 new progressives joined the Congressional Progressive Caucus because they won their primary. And in most districts in the House, the general election means nothing. It's all about the primaries. And the right-wing corporate money has figured that out. So they pour money, even if they're Republican oriented and hate the things that we love, they pour money into the Democratic primaries, dark money, dirty money, crypto money, military money, fossil fuel money, and they determine in far too many cases who the Democratic candidate is. And then when it's a single party Democratic district, they have to elect that Democrat. We have to stop that. And even in Massachusetts, that goes on. When you take somebody like Neil in Western Massachusetts, the ranking member on Ways and Means, his record is abominable. And the question
Larry,
is,
I
can we
think
find a candidate now that can defeat him?
Larry, thank you very much. I think we're going to run out of time, and we want to have at least, maybe we've got, 10 minutes for discussion. So I'd like to open it up to the group for
Sure.
that. I see.
Sorry if I went over.
No problem. I do see one hand raised. People can use the hand raise function if you'd like. And I see James Wagner, I think, has a hand up.
Yes, thank you, Alan. Yes, I have a question for Steffi. Yeah, so you mentioned community control, which really of healthcare, which really got my attention. I'm involved in a couple cooperatives in my hometown of Frederick, Maryland. So I see that as an advance compared to big corporations. What community, so a cooperative, by the way, for people who aren't well versed in it, it's an organization that's owned by the consumers of the goods, or there are also worker co-ops and worker consumer combination co-ops. So I'm wondering, Steffi, are there healthcare models that work as co-ops? It would seem that it would be open to that kind of a model.
Well, okay. To my knowledge, there are not, health organizations that work at co-ops. The one exception was kind of historic, which was a group health cooperative of Puget Sound, which grew out of the consumer co-op movement and used to really function like a co-op, but I don't think it really functions that way anymore. Certainly in some cities or communities, they do have city hospitals or public hospitals where there is real community control. As we know, not all cities are run very democratically, but some are. And there are examples of very good public hospitals with good community control. But I think the main thing is we need to be working on developing these models, because I do not think, I think funding needs to be done at the federal level, but to make sure it's equitable and fair and all communities get their due. But I do think the actual control of physicians and hospitals, we need to develop models where the folks who work there and the community have democratic control over what goes on. And we need to be hearing about models like you're talking about and thinking through some new models of how to make our hospitals really responsive to their communities.
Thank you, Steffi. I'd like to call on my personal state representative, Mike Connolly, who has a question.
Sure. Well, thank you so much, Alan. This is a little bit of a rhetorical question, but it's for Larry Cohen. I agree with you so much. And my question is, why did President Biden wait until that bogus debt limit deal was made to go to the Oval Office and address the nation with his first ever Oval Office address? Why didn't he use that platform a month ago to frame the debate in an intelligent fashion? And I admit it's a bit of a rhetorical question.
Yes, Mike, great to see you again. Thanks for all you do. Great leader. It is a rhetorical question. I think so. Sidestepping the answer because neither you nor I agree with that strategy. It's a horrendous strategy. Not only not going to the American people, but Mike, imagine this: in any kind of negotiations we've ever been involved in, it was only the White House on one side. The other side had not only McCarthy, but two of the key members of his caucus. Where was the Progressive Caucus of the Congress in negotiating this? Where was, Schumer wasn't even there, let alone the people that we would want there. So I think what's key really is we've got to fire up the people that we can fire up, and to say to them, you got to demand to be there, and our demands need to be there, and not repeat this again, because as you know, we could easily see a repeat where the White House says, we just want to get through this budget and we just want to get to the election next year. They just kick the can. They kick the can, and working class people get kicked to the side of the road again and again and again. I'll stop there, but thanks for what you do fighting every day.
Well, thanks for the answer. And yeah, wonderful to see you, Larry, and everyone else. Thanks, everyone.
Thank you. Suzanne Gordon has a question, a comment.
Hey, thank you. I kind of have two questions, one for Steffi and one for Larry. And Larry, you were pointing out about saving money and where we could save money. And obviously, right now, private sector care is eating up 35% of the VA budget, which I'm not very good at math, but it's like something like $44 billion, right? And I mean, they want savings. You could cut that. You could cut the $15 billion going to Optum as a third-party administrator of the program. I mean, there's billions and billions of the Cerner electronic medical record that was over almost $30 billion there. I mean, et cetera, et cetera. And I mean, maybe that's a comment, but and I guess from Steffi, when you did the piece for The Nation, Stephanie, about the need for a national health system, you mentioned the VA as a model. And I'm curious as to what you think about that. I mean, Deborah Berger suggested that, well, we shouldn't raise the issue of a national health system because it would muddy the waters. But I think you made it very clear that the people who are muddying the waters are the private equity companies and corporate healthcare, right? And to just deliver them into the hands to deliver everybody in Medicare for all into the hands of these people, I'm not sure is really making any progress. So I'm just wondering what you think about this issue of you and I have talked about this a lot, but VA as one of the models, the homegrown model for a health system,
Well, just like I think the co-ops provide a partial model, and some of the well-run public hospitals, and there are some, provide a part of the model. I think the VA provides part of the model. The VA has very equitable funding. It's very racially equitable. It has slightly better outcomes than the civilian sector. It has slightly better process quality measures in the civilian sector. So certainly, and nobody's making any money off, or traditionally no one was making money off the VA. Certainly the privatization was an effort to take that $44 billion and make it available for people to make profits off of, right? Shaving it off the VA and putting it into private healthcare. But I don't think that's the full model. I don't think that, it's a model that's built on the military and the needs of primarily men, and to a much lesser extent women who have been in the military before. And it's not exactly the same model that I think we're going to need for a community hospital, frankly.
Jonathan.
For Larry, one thing that's clear, if we're going to have some effect on going on the offense, right, there's got to be some national coordination, right? you know, there are 100 progressive issues. We can't have in Maryland, they're going around left end, and in New York State going around right end. Our experience in trying to do business with the Progressive Caucus is they don't have that mechanism. They're not interested. They're focused on the internal parliamentary battle. They're not paying attention to the grassroots. There's going to have to be some kind of national mechanism, national leadership to get a little unity on what we fight on. Our revolution, you guys are in place to do that, right? To begin to float. All right, here are a number of issues that if we all get together or out, we might get somewhere on. I think that's very important. We're not going to be able to figure out in Massachusetts what we should go to Elizabeth Warren on or Markey, given all the different grounds we could battle on. We need to know, all right, there's going to be some agreement that around the country, progressive forces are going to concentrate here. And so you guys haven't done that. You've been a little more democratic. You have forums and we hear about what's going on. But maybe we need you to step out and say, here's a plan. Or here's a meeting where we might.
Yeah. Well, so I think that's fine. You know, again, I think we are on defense to a certain extent here, and turning that is not easy. Let me just say this though, Jonathan. In this awful debt ceiling process, you did see the leadership of the Progressive Caucus and 28 Democratic senators vote against the Mountain Valley Pipeline. Now, that's not what we were here to talk about today. It was a key environmental test, but it did show that even in the worst of circumstances, it wasn't just give up and go along. I think that the key now is to work with, you know, the Markey, Merkleys, and we will do that for sure. There's already a convening of key environmental groups, and we need to bring into that, as you just said, a wider set of demands. But at the end of the day, we will need the Progressive Caucus and the Progressives, which is only about 10 senators. But so then the rest of us organize the next 15 or 20 Democratic senators, ideally, so that we can have a majority of the Senate caucus, and then we have a chance. But I don't disagree with you. We're going uphill on everything we do, so it's very hard to win in the short term, much of anything. And that, you know, demoralization sets in as a result. But, you know, my own view is there is a strategy. Part of it is with the Jayapal in particular and her caucus, which is 100 Democrats there. And over on the Senate side, there is a strategy with Sanders, Warren, Merkley, Markey, and Baldwin. There's about 10 of them. And then to mobilize to get 15 more. And then we have the elections in 2024 when we go at it again. I'm not a leader for this. I just don't think we have any choice but to fight these fights, even when it's not clear that we'll win them. We will do what you said. We will pull together. We will do what you suggested. I agree. Pull together. What is the coalition demands, and how do we all, no matter where we come from, mobilize around them?
Let me say, in Mass Peace Action, you know, we have committees for in every U.S. representative district, and we meet with them, and of course relations with Warren and Markey, and we have a membership who believes in this kind of political mobilization. So if we have a little guidance, you know, we can mobilize our troops. And in fact, I think on that note, I would say we should close out that there's a little positive vision here. It's tough going, you know, hearing about the VA getting privatized. Oh my God, you know, and the vaccine situation. However, right, there's been some victories around the country in Wisconsin and Supreme Court with the voting rights, and so we're not going to give up. Certainly in the peace movement, we've been at it too long. And we're looking forward to work together with so many of you, National Nurses United, Mass Nurses Association, APHA. And pretty soon, in early fall, we'll have, I think, another, just a little 1-hour session on trying to take what Larry said, translate it into an actual political action plan.
Jonathan?
Louise.
Oh, I just was wondering, we're going to have everybody's emails sent to us or listed or something like that? How can we do that?
Well, Cole we have the emails of everybody who registered. And so it can
Right,
be,
because people wanted to talk about the Oppenheimer of the film.
so we can make it into a list and,
Okay, thank you. Thank
Right.
you.
right.
Thanks a bunch.
And we will do that. We're not having formal report backs. It's a
That's
lot,
good. That's fine.
but I'm so glad that on a beautiful Sunday, so many of you were
Great.
very, very high quality. We all learned from each other, and we're gonna have to continue doing that. So
Thank you very, very much.
carry on, and thanks a lot.
Thanks.
Thank you, Jonathan.
Solidarity.
Hey.
Good work, everybody.
Oh, yeah, great. Great
Thank you.
forum.
Thank
Thank
you.
you.
Thank you.
Thanks.
Yes, thank you. This was great.